Chapter 17, Symptoms, Course, and Complications of Acute Urethral Gonorrhea in the Male. Since acute gonorrhea of the male urethra always begins with inflammation of the balanitic urethra, footnote, excepting cases of reinfection of the urethra from gonococci that have lain quiescent in the urethral glands, which cases are properly classed as relapses. Continues by direct extension of the inflammation along the urethral mucous membrane and may terminate before the inflammation reaches the posterior urethra. To be accurate, we should speak of anterior urethritis alone as essential gonorrheal urethritis and class all other gonorrheal inflammations, including posterior urethritis, as complications. But inasmuch as the average uncontrolled urethral gonorrhea invades the posterior urethra, the trigone, and the prostate, it is clinically convenient to group anterior urethritis, posterior urethritis, and prostatitis in the type description of the disease, and to follow with the description of other inflammations as complications. Accordingly, we shall describe the incubation, typical acute gonorrheal urethritis, atypical acute gonorrheal urethritis, prolonged or complicated cases, mild cases, severe cases, cases modified by treatment, complications of acute anterior urethritis, abscess of the urethral glands, periurethritis and periurethral abscess, inflammation of the erectile tissues, balanopostitis, lymphangitis, lymphadenitis, complications of acute posterior urethritis, prostatitis, prostatic abscess, seminal vesiculitis and deferentitis, epididymitis, cystitis, pyelonephritis, peritonitis.